Thank you for joining us at 6. I'm Rolly Hoyt. We begin tonight with a look at how hospitals are helping people post-COVID. Sometimes the breathing issues linger, lasting longer than the virus itself. But as THV 11's Frederick Price shows us, an Arkansas hospital is hoping to change that.
For many people, COVID-19 has lasting effects.
Shortness of breath and exercise intolerance, but it can be heart palpitations, balance issues, fatigue.
Amanda Seisuda with the Arkansas Heart Hospital says it's something that is even more common than we think.
A number of Arkansans who have been positive for COVID over the last 2 years now. Many of those patients have lingering symptoms.
So how do you get those people back on track? Seisuda says last month the hospital was approved to begin a program that aims at helping folks who have lingering effects from the virus.
We sit down one-on-one with one of our exercise physiologists or nurses who will go over their current symptoms and kind of set a goal for their exercise prescription.
Here is how the post-COVID pulmonary rehab program works. For 12 weeks, those enrolled in the program come to the hospital 3 times a week to exercise for nearly an hour each day.
And that doesn't mean that they're exercising for a full hour, because a lot of patients that we're seeing right now that are starting with us are only able to tolerate about 15 minutes of exercise.
These exercises will allow people with breathing and cardiac issues to really work to improve their long-lasting symptoms.
Someone who comes in with shortness of breath still will work a lot on breathing retraining.
And this program is fairly new. The hospital actually started it this month, and they tell me they have about 10 people in it already. Doctors and nurses will track the progress of those patients until the end of their 12 weeks. In Little Rock, Frederick Price, THV 11 News.
Frederick, thank you. The Heart Hospital says that any adult that is experiencing COVID symptoms beyond 4 weeks qualifies for the program. It also requires a referral from your doctor.